All right, welcome back. It's still Good Morning Nigeria live on the network service of the NTA. And to begin our conversation with borders on 2025 fight against cancer, let's quickly see this background report put together by our correspondent Ibrahim Bello Gunda.
Cancer is one of the leading causes of death globally, accounting for almost 10 million deaths in 2022 alone. Approximately 70% of these deaths occurred in middle-income countries, with cancer accountable for 80,000 deaths in Nigeria during the year under review. Cancer disease burden is coupled with significant out-of-pocket healthcare spending in the country, with majority of Nigerian cancer patients paying for their care without financial support. The National Health Insurance Authority, expected to provide respite for patients, has a huge gap to fill in terms of providing adequate coverage for cancer treatment, and unfortunately, the gap still remains. In the last decade, Nigeria is making steady progress towards expanding care for millions of people with various stages of cancer by strengthening institutional response, increasing resource allocation, and building its oncology workforce and services to tackle its cancer burden through its National Cancer Control Program. With over 220 million people and nearly 128,000 new cancer cases per year, Nigeria's healthcare services, which are concentrated around larger cities, compound to the problem of accessibility. The most frequent type of cancer in Nigerian men are prostate, colorectal, and liver cancers. Breast cancer, with over 2,200 and more than 16,300 deaths per year, is the most common cause of death from cancer among Nigerian women. Cervical cancer also poses a major challenge, accounting for the second largest number of female cancer deaths in Nigeria. In October 2024, an impact review team comprising International Agency for Research on Cancer, World Health Organization, and 12 independent experts interviewed local health authorities and held extensive consultations with cancer stakeholders, including patients and advocacy groups. Their review found that Nigeria has taken positive steps to strengthen cancer care since the last impact mission to the country in 2011, including the establishment in 2023 of the National Institute for Cancer Research and Treatment. The institute has since launched the National Strategic Cancer Control Plan 2023 to 2027 and is working with several partners to implement its activities in cancer prevention, diagnosis, treatment, hospital, and palliative care, as well as data management and advocacy. Findings reveal that low public awareness, inadequate funding, and shortage of manpower, limited access to therapies, and poor health insurance coverage hinder care for cancer patients in Nigeria. What is the next step needed in the fight against cancer in Nigeria? What role should health insurance, among other stakeholders, play? These and more will form part of the questions that guests on Good Morning Nigeria will find answers to.
All right, many thanks, Ibrahim Bello Gunda, for that background report. And now joining us for the conversation on the 2025 fight against cancer. Let me begin by introducing here Professor Usman Waziri Mohammed, Acting Director, Cancer Prevention and Control at the National Institute for Cancer Research and Treatment. A pleasure to welcome you to Good Morning Nigeria.
It's a pleasure too to have me. And good morning, Nigerians.
Thank you. And let me also welcome Dr. Amaka Lashibikon, Acting Director, Cancer Research and Innovation, National Institute for Cancer Research and Treatment, NICRAT. Good to have you.
Thank you for having me, and Good Morning Nigeria.
Yeah, right.
All right, you're welcome, gentlemen and lady. Let's get into it now. The cases, if you like, cancer burden in Nigeria seems to be increasing. Is the government, or if you like, is NICRAT doing anything specifically to reduce the numbers?
Yes, quite sure. The burden of cancer, not only limited to Nigeria, globally, seems to be rising. Like according to the most recent statistics that we have, Nigeria has recorded in the last in 2022, Nigeria has recorded almost 128 new cases of cancer, with almost 80,000 or 80,000 mortality from it. And as highlighted in the background, the commonest cancers seen in Nigeria are basically the breast cancer, cervical cancer, prostate cancer, colorectal cancer, and non-Hodgkin's lymphoma. Also, liver cancer contributes significantly to that burden. Yes, but fortunately, the government has actually been putting in tremendous effort to address this rising menace of cancer in the country. One of such events is the establishment of the National Institute for Cancer Research and Treatment in 2023. So barely 1 year plus old institute. And since the coming of the institute and looking at the burden, the rising burden of the disease, we have put in place strategic steps to really address this rising menace. One of such, as highlighted in the background, is the coming up with strategic documents in the area to address the rising burden. And in terms of National Strategic Cancer Control Plan, the National Strategic Plan for the Control of the Cervical Cancer. Why the cervical cancer? Because cervical cancer, as mentioned earlier, accounted for the second most common burden of cancer in Nigeria, and leading to high mortality among the affected women. And secondly, unfortunately, this same cancer is preventable, can be detected early at a precancerous stage, and can be treated. So along with that, then we set up a research agenda also for the country. And so far, so good, with the support we are getting from the parent ministry, the Federal Ministry of Health and Social Affairs, and the government of President Bola Ahmed Tinubu. We are able to set up strategies that are already presently in the area of prevention. The government is working to ensure that access to preventive services, as the saying always goes, the prevention is not only better and cheaper. So we are focusing mostly on prevention, because when we are able to pick, we realize that looking at the burden of cancer in Nigeria, the two major hurdles are late presentation of most of these cancers due to late detection, as well as limited access to care because of cost.
Thank you, Dr. Mohammed. In fact, that will lead me to my question to Dr. Lashe, because you see, we are talking a lot about prevention, yes. But why does it still seem like once you are said to have cancer, it's almost a death sentence? Of course, he's talked about, late presentation. How can we also begin to detect early enough? You can prevent for all you want to, you can prevent all you want, but some will still go through. And so how do you detect early enough to ensure that people can present early and can be tackled early? Because there lies, the reduction in the burden that cancer has become.
Yeah, I think that's a really good question. And I think that even as we think about early detection as an entirety or a means to an end, we also need to think about what happens after the patient is detected early. Because one of the activities we are trying to do, like he said, is to really go down into the community level to try to create a lot of awareness and get people to start talking about it, to understand that it doesn't really have to lead to death, that it is not a death sentence. There's a lot of stigma that's associated with cancer. So part of the rural community engagement is to increase awareness and also to destigmatize cancer. But then once a patient is detected early, what happens next? We have to think about it in its entirety. The whole health system needs to be brought into sharp focus. So which is what NIGRAT is doing. We're not cherry picking, but we're looking at it in a holistic manner. Because after early detection, where do the patients go? What happens to them? Is treatment effective and safe treatment? Is it available? Post-treatment, what happens? So
But is it? You haven't told me.
I will answer that. So as the reporter said, one of the two problems we have in the country is around access and affordability. So the access is, NICRAT is working through different partners and of course with the Ministry of Health to improve access to most Nigerians. Right now we have 6 centers of excellence. We want to increase that number to 12 across the country. So we're talking about geographic access here, increasing
where people can go to when they have these problems. Then we're talking about affordability. Cancer care everywhere in the world is expensive. And there comes the National Cancer Health Fund, which is a scheme that had been piloted in the last 3 years, thereabouts, where indigent patients actually go to these designated hospitals and access their care free of charge for the top 3 priority cancers in Nigeria, which is breast cancer, cervical cancer, and prostate cancer. So a little something for affordability is not much, and I know NICRAD and the Ministry of Health has also said that we're going to expand the number of centers that are participating in this and also increase the number of cancers that the federal government will cover and also increase the budget allocated to fund this cancer. So aside from funding and increasing the numbers, capacity development, you need a skilled workforce to be able to deliver good quality care to the cancer patients. NICRAD last year ran a couple of capacity development workshops for different cadre of healthcare within the healthcare sector. So we had the nurses that were trained, the oncologists that were trained, the surgeons that were trained, and we're looking at pediatric cancers have also been neglected, but we're also trying to prioritize that as well. So the medical physicists, the therapy radiographers, so everybody really within that ecosystem that has a strong role to play in improving outcomes in cancer care.
Is it just skilled workforce that is required, to fight cancer in this country? What about infrastructure? If you have the skilled workforce and there's nothing to work with, how do you deal with it?
Which is why I said at the beginning that the federal government is increasing the number of oncology centers of excellence from 6 to 12. And I agree with you, it's not enough, but it's a start.
How are you dealing with mass exodus of professionals out of the country, of course, seeking greener pastures? Or is are cancer professionals not affected?
Well, this is really a very good question, right at the right time. I'm quite sure the issue of massive Japa syndrome, as court is generally referred to, is really a serious issue, not only limited to cancer care, but generally to the general healthcare system in the country. But I think, notwithstanding, government is really making a lot of efforts through the Federal Ministry of Health to ensure retention, as well as we increase the number of workforce that are being produced for that. And at the level of the institute also, we are not unaware of that, and in collaboration with the Federal Ministry of Health also, as she rightly said earlier, we are having a robust plan for capacity building, and not just for capacity building, to ensure that these professionals are really appropriately incentivized and to retain them and then create an enabling environment. One of such example, one of the example of such effort by federal government is, you can see at the Lagos University Teaching Hospital, NSIA. Public-private partnership in the area of cancer care is really doing a lot in addressing that, and it's one of the strategies the federal government is employing. If you go to Lagos Cancer Center right now, because of the deployment or the use of a public-private initiative, you hardly see any oncologist or any specialist in the area of cancer care that has left the country. And this is because enabling environment, we're able to create enabling environment, as well as incentivized significantly, and they have everything at their disposal. So the same thing now is being replicated in Sokoto Cancer Center, and it's really functioning well. So this is a very good strategy the government is using to ensure that we retain and retrain cancer specialists to really address this rising menace of cancer in the country.
All right, many thanks, Dr. Mohammed. Dr. Lashibiko, you are in charge of cancer research and innovation. With the number of cases that we have these days, it's worrisome, and then you now begin to wonder, is that something we're not doing right? What exactly is responsible for this? Could you tell us why the certain number of people, coming down with cancer? And then is that something Nigerians can do, or is there a way they can be empowered to take charge of their health, just so that they're not at risk of, coming down with any of the cancer?
Well, to answer your question, yes, there's a lot that can be done. He talked about for cervical cancer prevention and screening. So knowledge is power, which is why we are trying to really focus on creating awareness. For some of the preventable cancers, information generation. We disseminate information on what people can do, and those that are not readily preventable, we are trying to disseminate information on the earliest symptoms that will make someone suspect that something is not right and then go to the hospitals. So yes, there's something they can do. And of course, to answer your question, like you said, cancer is rising globally, multifactorial reasons. Mainly, we've adopted westernized lifestyles. There's diet that has changed. Sedentary lifestyle also has changed, is on the increase.
Is that a factor?
Oh yes, it is a
Sedentary
factor.
lifestyle
Yes, it
for
is.
cancer?
Yes, it is. They share the same etiogenesis with other non-communicable diseases and sedentary lifestyle diseases. So it's advised that people should be active for a minimum of 30 minutes a day. It's been proven actually to reduce the incidence of that. And even for patients on treatment as well, it also helps to boost their well-being, and even in the survivorship space. So physical activity, really, the emphasis and the role of physical activity cannot be overemphasized.
Thank you, Dr. Lashebikon. 2025 cancer, fight against cancer, Dr. Mohammed, what's in the arsenal?
Yes, we really have a lot. Fundamentally, we are looking at it from across the whole spectrum of care in 2025. So first, to start with, in the area of prevention, the Institute, through the federal government and the federal support of the Federal Ministry of Health, is making a holistic effort towards routinizing, ensuring that screening and early detection of these cancers is routinized in the country, so that people should not just go to the hospital when they have the disease, but rather can have access to screening services routinely across the country. And this will go a long way in enhancing early detection, treatment of precancerous lesions in the area of cervical cancer, improving treatment outcome, and generally reducing the burden. As you rightly said, with regards to the treatment, as I said, we are looking at it across the whole spectrum. And the federal government of Nigeria, through the Federal Ministry of Health, is really expanding to 12 cancer centers across the country. This will really improve access.
Is that sufficient, though? 12 centers?
I quite agree with you, not sufficient.
For hundreds of millions
for
of people?
over 200 million population, but at least it's a very good starting point, and I'm sure the process and the effort will continue on the part of the government. So that is still a step further, even though it may not be sufficient, and that will really definitely improve some access to cancer care in the country. In the area of research too, we are doing a lot, more especially in the area of bringing precision oncology to the country. Precision oncology is really what is obtainable in the other parts of the world, where people usually get individualized care for cancer, and that really improves treatment outcome. And right now, we are already piloting researches in the area of cancer genomics to really improve targeted therapy and precision care in Nigeria.
All right, many thanks, Dr. Mohammed, Dr. Lashebikon. All of this that NICRAT is doing, we may not really hit the target if some myths and some conspiracy theories around cancer, are not shattered, or if you like, properly explained and all of that. You talked about, I think, is it cervical cancer? There's a vaccine, I think, and there's this theory that it's to cause infertility and all of that, and then when someone is diagnosed of having cancer, of course in some climes they tell you it's your village people, go take one herb and it will go away and all of that. So how do we, this 2025, how do we work around all of this just so that we can reduce the numbers?
So like you rightly said, most of this information was generated from outside of the country. So which is why the Institute has set a strong emphasis on locally generated data, cancer research. So part of the things we are trying to do is to, already we have, through the SINCA project, which is strengthening institutional capacity for cancer research, we have identified 14 schools, 14 institutions across the country, and we have started off with the needs assessment to understand what exactly they have within those institutions to support good quality cancer research, both the infrastructure and the human resources as well. And the idea with that is to build a crop of leading institutions, strengthen them and empower them to be able to generate local evidence to support or inform cancer treatment in Nigeria. And I know that once we are able to show the rest of the Nigerian people these locally generated data, the evidence that was born from somebody they know, it becomes easier for them to relate to it. It becomes easier for them to understand that, for instance, with cervical cancer vaccination, the HPV vaccination, it will not cause infertility. So these are the areas that we are looking at and prioritizing, promoting locally generated evidence. Like you said, aside from the strengthening institutional capacity, which is the SINCA project, we are also doing the genomics research, because even in treatment, the treatment outcome is dependent on the person's genetics, the environment, and a host of other factors. We borrow treatment plans from outside of the country. So now we're looking to what is it that Nigerians have? What is it that we are doing that most times we're not getting the same outcomes as has been published outside? We're also looking into our own roots, our own herbs, to see whether we can provide solutions, that are locally available, that also driving down the costs. So research is a strong bedrock if we need to improve cancer indices and the outcomes here in Nigeria.
Earlier you spoke about early detection being a key to all of this, but you see, some people would wonder if that's possible in Nigeria, where most people, especially in rural areas, have only very few have access to primary healthcare centers, and in these primary healthcare centers, of course, early detection of cancer is not possible. So how is that early detection? How is it a solution to this problem when, it's only when you get to tertiary health institutions that you can even detect that someone has cancer. So what's the way forward for millions of Nigerians that don't have access to tertiary health facilities?
So I wouldn't say it's not possible. Before now, we had not thought it was possible, but it is possible. So that is why we are really going in. The focus now is to go into those communities, empower the CHOs, the CHUs. These are the frontline health workers within the communities with the knowledge, simple symptoms and signs that they can pick up to detect that this person may have cancer. And then let those health quarters know that if you see A, B, C, D, refer to the next place. And then these other center, maybe the general hospital, is also equally empowered with the right knowledge to know that this is outside of my skill set. And then I refer back all the way to the tertiary facility. So it is that chain that we're really looking to build, so that perhaps next time we come, it will no longer be a case of it is not possible, but it is actually working.
All right, Dr. Lashibiko, many thanks for your intervention. Dr. Mohammed, what are the latest breakthroughs in cancer management? And I'm thinking about technology, I'm thinking about AI, and how are we faring in these spheres?
Yes, quite a lot of innovations have actually come into play in the area of not only cancer care generally, health care system and health system delivery, health services delivery. Yes, we are not unaware of that, and we are really working tirelessly to get it incorporated into the Nigerian healthcare system, more especially in the area of cancer care. Currently, most of like in the area of artificial intelligence, this is really an area the Institute is really working, because we can leverage on AI technology to really address the huge manpower gap in the area of cancer care. So, and that is actually what we are right now. We've established a collaboration with a certain institute abroad, covers algorithm, to originally ensure whatever we do in the area of artificial intelligence generally is data-driven and data-dependent. So we are working with these international partners to generate data in the area of cancer care in Nigeria, and at the same time to build capacity and human capacity development, more especially in diagnostics. For example, you take, for instance, diagnosis of cancer. Most often, as you rightly said, are usually limited to the tertiary healthcare facilities, which are really not enough within the country. And as the director researchers have pointed out, so that is one of the areas we are leveraging on. If we can get AI-based technology that can really ensure adequate coverage, so that we can equally deploy technology to even some of these tertiary and secondary healthcare facilities that perhaps may not have enough hands to give them adequate and accurate diagnosis, which AI has actually been proven in, through a lot of research to really be able to bridge that gap. Then this is a very strategic team we are deploying in the area of cancer care, not only in treatment as well as in the training and in the screening area also. Making the diagnosis, radiological diagnosis, is one of the very important diagnostic tool and diagnostic strategy in the area of cancer, more especially in lung cancer. We are currently working with international partners to ensure that we developed AI-based technology that can actually be deployed to some of these hospitals. And as you rightly pointed out, at the institute level already in the area of cancer care, we have done mapping of all the cancer care facilities within the country, from the primary down up to the tertiary healthcare facilities. And what we are coming up with to strengthen the cancer care, inclusive of the National Cancer Health Fund that we have gotten the matching order from the federal government to expand, we have developed a system of patient navigation and referral, where we have the hubs that constitute most of these tertiary health facilities. Then we have the sub-hubs, mostly the tertiary health facilities, as well as secondary facilities that has no enough equipment to really take care of cancer. And then we have the feeders, comprising of the general hospital and the primary health care facilities. And that has actually gone far in that area. So we are really working to ensure, and this can only be achieved mostly through the deployment of technology. So we are really leveraging on technology in the area of treatment, in the area of diagnosis. Another important area we are really leveraging on technology, more especially digital pathology, telemedicine, is the area of multi-dimensional or multidisciplinary tumor board management. In the area of cancer, cancer is actually requires multidisciplinary approach to management, meaning that you may need an oncologist, a surgeon, a pathologist, a radiologist, a radiotherapist, and host a lot of them, inclusive of community and medical social workers.
So it's a bit complex.
So it's a bit complex. So which we cannot get full complement of these personalities in one hospital.
Do we have the infrastructure, the infrastructure for these technologies that they're talking about?
Yes.
Do we have the infrastructure in place, or we still have to develop them?
Yes, it's a work in progress. Most often we believe, at the Institute, honestly, we believe nothing that we cannot do it should not actually come about. We should be able to do it. Because
the fact
smaller countries are actually doing it. Why not Nigeria? A small country like Rwanda has achieved a lot in that. So we believe we can do it. We have the human resource, and we will definitely, the material resource is limited, but we will definitely leverage on collaboration.
I like the optimism of, NICRATs. It looks like, you breathe and live, on it. And I hear that that's what cancer patients also need to survive. They need to be optimistic that, they will get out of it, successfully. But you see, as we begin to round up this conversation, you talked about affordability earlier, and you only spoke about the fund. And I'm thinking that cannot cater for the number of people that, have to undergo treatment. In your own view, what other ways can we deal with that, cost of having to manage cancer away from the fund?
All over the world, cancer care should not be managed by individual resources. And this is something that the government has also bought into with the establishment of the pilot project. The pilot project, we saw a number of patients. I think the last count there were over 1,000 patients, not enough, that have benefited from the fund. And so, like he said, the federal government has seen the importance. Part of the things we're also trying to do is to show the people, the policymakers, the return on investments of really investing in providing funds to support cancer treatment through the CHF. But aside from the CHF, now, okay, let me just talk a little bit about the CHF. So the CHF is not just that you go in, you take the money, and you get access to treatment. A core component of treatment requires drugs, chemotherapy. To be able to afford that on the CHF, there are a couple of partners that have come together to try to bulk purchase these drugs and reduce the cost. So that is a cost-saving mechanism that is in place and which we hope to expand. There have been lots of problems with the fluctuating dollar rates, as can be imagined, but that is a definite sure banker cost-saving mechanism. Then cancer care, some part of it is also put on the NHIA. As the federal government, through the Ministry of Health, expand that, we expect that more patients will be able to benefit from
insurance.
Exactly. So these are just one or two. At this point, we also would like to appeal to philanthropic organizations, the foundations, because everywhere in the world, people come together and make these funds available to be able to support patients.
But are you making the move, though? Because you could, do the advocacy yourself.
Yes, that is definitely.
You talked about return on investment. I don't understand that. Is there a return on investment?
Some of these patients, not even some, most of them, particularly with breast cancer patients, prostate cancer patients, they are in the prime of their life. And they are giving back to the society. They contribute to the growth of the country. Mothers, women are in the house looking after the children, ensuring that the child, her child, whoever she is, may be nurturing the next president of the country. Now, we need to be able to properly articulate all of this together. How, for every naira that is spent through the CHF, these are the benefits that accrue. People are able to have access to treatments, get cured, and return back to the workforce and give back to society. Children are not orphaned at a very tender age.
Fantastic.
And we lose all of that.
We've run out of time, but I'd like you to just give us the statistics of those who have been able to survive treatment in Nigeria. Do we have a figure?
That is one of the things that we are trying to do. Data has not been very well articulated in Nigeria.
Okay.
But like he said, the statistics that we are working with shows that more than 2/3 of patients with cancer don't survive the 5-year mark.
Not a good one. Many thanks, Dr. Maka Lashebikon, Acting Director, Cancer Research and Innovation, National Institute for Cancer Research and Treatment. We should add optimistic NICRAT to that. Many thanks for joining us.
Thank you. Of
course, Dr. Usman Waziri Muhammad, Acting Director, Cancer Prevention and Control, National Institute for Cancer Research and Treatment. Many thanks for being our guest. We appreciate both of you and continue the good work. We hope to see that statistics change, of course, for the better. So that's Good Morning Nigeria this Friday. Many thanks for watching. I'm Henry John. Have a great weekend.
And I'm Victor Azu. Thank God it's Friday.